Hello, everyone. Thank you so much for bearing with us. We had some technical issues with our webinar platform where our presenters were presenting to no audience, but hopefully it looks like we have about 70 people in the audience. Our presenters were kicked off when we restarted the webinar. So if we just hang tight while they get loaded up, we'll be able to restart this webinar. We appreciate it. And for those of you who aren't able to stay to the end, we'll have a recording of this webinar located on our Forum B discussion platform. So we appreciate you bearing with us, and it sounds like we have a few of our presenters on. Sandra, can you hear me?
Yes.
Perfect. And Alex?
Yep, I'm on.
Okay, we're just waiting on Lucinda Perry-Jones.
I'm here.
Oh, perfect. Okay, so then I will kick it back to, why don't we kick it to Alex to preface.
Great, thanks. Thank you, everyone, as Monique said, for bearing with us. I guess we realized a few minutes in none of you were hearing the presentation, so I'm glad you're still here. I'm not going to go through, at the beginning I read our two speakers' bios. For sake of time, I won't go through all of that again, but please log in, like Monique said, to the recording of today so you can hear the first part of the webinar. And please, just as a reminder, to visit the Forum B site following today's presentation where we can continue the conversation. So without further ado, I'm going to just kick it back over to our first speaker, Lucinda Perry-Jones, who's the Director of Strategic Initiatives at Operation Food Search. And Lucinda, I'll leave it to you in terms of where you want to pick up, maybe just breeze through the first couple of slides, and then we'll catch up on some time and continue the Q&A via the forum site.
Okay, so shall I start from where I left off, or do you want me to start at the first couple of slides, or?
I think if you devote a few minutes to the first couple of slides and then go back to where you left off, that's perfect.
Okay, great. So if you want to flip to the first slide. And I had just shared that Sandra and I were really excited to be with you here today, and that we're presenting two different perspectives to you today. I'm talking more in general about capacity building in broad terms and looking specifically at how funding, policy, innovation, and evaluation intersect, and sprinkling in some of my own experience of working here at Operation Food Search. And then Sandy's going to do more of a micro perspective about looking at how they're amping up their efforts in Colorado to reduce food insecurity by sharing a case study with you. So next slide. So my professional background is that I've had the opportunity to work in nonprofit government and the nonprofit sectors, and I've learned to survive and to tell the tales, because many of you who are engaged in capacity building know that it is not always, that it is sometimes a messy process, but it's one that really excites me a lot. So I'm excited to share what we've learned at Operation Food Search with you today. So Operation Food Search was funded in 1981 as a traditional food bank model. In other words, we collected food from going into the landfill from our local grocery stores, and we have a particular focus on having a dedication to ending childhood hunger and family food insecurity. And in 2016, we had a real wake-up call, and that was that our state of Missouri was ranking in the top 10 for food insecurity. And we as an organization said that there needs to be some urgency around this issue and addressing the issue. And a lot of it was a result of the recession and seeing this whole influx of people who had never utilized our services before come to the table. So as I continue through the presentation, I want you to think about where is your wake-up call in your organization. It could be something that's related to funding. So for example, you could have an influx of funding. You could have a huge reduction in funding. It could be a change in leadership. Whatever it is, there is probably something that is going on in your organization that is prompting you to have an intentional capacity building initiative. And as you think about creating that urgency and building your organizational capacity to address internal and external capacity, think about leadership, leadership, leadership. I can't stress that enough. If your leadership is not involved in these efforts and completely engaged, it makes it harder than ever to accomplish them. Also, think about staff training and expertise. Often capacity building means change, and they'll need new skills to be able to rise to the occasion in that new change. And then also, when you're looking externally, to look at the partnership network in your community food partners. What kinds of needs do they have? What kinds of fears might they have? And so really do as much as possible, do an audit of what your strengths and threats might be. So next slide, please. So I really love this slide as just level setting what the definition of capacity building is for the nonprofit sector, and I thought it would be really useful as a definition builder today. So the words that I really love in this particular slide is looking at that first pillar is the next level. So how are you using capacity building to take your organization to the next level? I also love the organizational maturity, because with each capacity building project that you do, it does make your organization more wiser. You have more resilience and ability to address the major issues that we're called to solve today. And then lastly, it's allowing us to advance our mission in a much deeper and more impactful way. And then the reason I like the slide on the next side is that it talks about continuous improvement. So I really believe that capacity building is a little bit like the game of whack-a-mole, where you constantly are thinking, okay, I've got this one side of the organization really figured out, and then something happens, like a wake-up call, or you discover some kind of trend that's going on, and all of a sudden, here's another opportunity to go to the next level with your work. So it's never really done. So next slide, please. So what can you do to make your organization more resilient and responsive and capable of capacity building, both internally and externally? For us at Operation Food Search, it's constantly investing in these key factors that are listed below. The first one is funding, innovation, institutional and public policy, and evaluation. And for your organization, these key factors might look completely different, but the story is to figure out what levers do you really need to invest in to bring the biggest bang for your capacity building project. So next slide. So everyone knows that funding is critical to organizational growth, but when you think about funding, are you thinking about the whole range, a whole portfolio of how to support funding? So it could be, for us, philanthropy is a major piece of how we fuel our growth, and it's our lifeblood. But also, thinking about earned revenue. Perhaps you're thinking about a social enterprise situation that might be able to bring you in more income, or perhaps you're going to go for more state or federal funding opportunities. Even tax referendums can sometimes bring an influx of resources, financial resources to bear. So when you think about funding, think about how can I go beyond just one source of funding and think more holistically about that. I will say that when it came to our fundraising, we absolutely came to a wake-up call where not only were we falling behind in terms of food insecurity as a state, but we were also growing completely out of our building that we had. So our wake-up call was that in order for us to make any kind of changes, we had to get into a new facility. And so we launched a $7 million capital campaign that included program support to give us the ability to go to a next level of our organizational maturity. So I want to say that when you're on that path to make sure that you're very clear about what this capacity building project is going to do, and not from a numbers perspective, but from changing and saving lives perspective. That's something that everyone wants to get behind. So talk about the solutions that you are going to be solving as a result of this, and not just about the need. And then also make sure that every staff member is involved in the effort. If you're not already really good friends with your development director or the person that is responsible for bringing in grants and other opportunities, get to know them, because they could be great partners for you in the effort to grow your department or to grow your organization. For us, the potential barriers is that not everyone likes to engage in fundraising. Not everyone likes to ask for money. And so there is sometimes a bit of uncomfortableness that comes with this. And so just be aware of, what sometimes the fears that people have around money and growth, actually. So with this enterprise that we were able to put together, we started with assets of $4 million in 2015. As of 2020, we are now, we just came out with our annual report, and we reached $11 million in organizational assets. And that has really fueled the engine for us to continue to grow as an organization. Next slide, please. And then innovation was something that we knew we had to really invest in. And when you're looking at root causes, like we all are, it is really about presenting solutions and advancing organizational impact and thinking about doing things differently. And that's not always easy to do in the food insecurity model, because we've basically been doing the same things the same way for all of these years. And I'm really excited that I think that the field is getting to the point where we can think differently about this as a result of social determinants of health and the kinds of outcomes that we're seeing. It's allowing us to really stop siloing food and think about food as a part of a whole systems approach. This hasn't been an easy journey for us, but it's certainly one that is compelling to our partners, to our donors, to our community, and to our state, to really think about how are we getting to the root causes. And so some of the tips that we were able to do is to really allocate specific money to look at pilot programs. We're really building the capacity for our staff to support a culture of innovation and collaboration. So new ideas are welcome, and no idea is bad until we really decide on what is the best approach. And then most critically is crafting your story. When you ask people to imagine and to picture living in a different world than what they are now, it's inspiring. And so think of ways that you can tell that story so that you can continue to get that funding needed to innovate. And for us, we launched a couple of new programs called Fresh RX programs, which is really connecting food as medicine. And it's really inspired a whole new cadre of funders, of supporters, of people who want to work with us. And just since 2017, when we established that sort of capacity building initiative, we now have 10 new staff positions that have been created since 2017. Next slide. And then the next one that we've really begun to look at is policy. And, so many people, organizations really focus on specifically blocking bad laws and trying to advocate for good laws. And that is really critical. We absolutely do that too. But I also want to encourage you to not ignore the power of institutional policy. And when we think about building capacity of organizations, we know that we can't fight this issue all by ourselves. And so that requires us bringing on a lot of new partners, sometimes non-traditional partners that have never worked in the food space before, but are starting to realize that food is a critical component to their success as well, either for their clients, for their workforce. They're beginning to make these connections between food and health. And so this is an opportunity for us to share our expertise with these partners and to say, help them develop some of their institutional policies that are going to support their clients in a new and different way. One thing that I'll just touch on really quickly is that we've been working extensively with both traditional and non-traditional partners to help them incorporate the hunger vital sign in their assessments. And the reason that we're doing this is that we really want to take away the stigma that is associated with hunger. And we feel like that the more that people are asked about food insecurity, and we all know it's something that everyone is really just so hesitant to talk about, and it's such a trauma for people that a lot of people don't want to come forth and get the help that they desperately need. And so the Hunger Vital Sign is something that we're helping organizations really institute and have as part of the way that they intake clients. So the tips that I can have around something like that is to really start with trusted partners who are willing to work with you to figure out the systems that work, what fails, and to keep on trying and not to give up, that this is not too hard for all of us to do together. When they have some collateral or some skin in the game, as people like to say, then magic can really happen. We can start to turn attitudes around the issue. And then I would just say, a potential barrier is just be clear that your organization and the people that you're working with understand the difference between lobbying and advocacy, because sometimes there's a fine line between the two, and just to be clear on how you're educating elected officials is really critical. So next slide. Evaluation. This is something that at Operation Food Search we are still really wrapping our arms around, but it is really critical to, as much as possible, embed evaluation in the program or their initiative before it launches, so that all of the partners, all your staff, all the people involved can really understand what success looks like. It's, some people use logic models, evaluation plans. Often, startup organizations or organizations that have more limited resources say, we simply can't afford to do this. We understand, as I said, we're still building our capacity in this way. But some of the tips that have been really successful for us is consider partnering with a nearby university. We are really fortunate to have many higher education partners that are willing to work with us and to take advantage of their expertise. And also there's so much rich data out there from a federal perspective. Really do some digging and see, even if you're not able to do major scale research initiatives, that you're taking the data that's been collected on a federal level and trying to show the impact of how that could work on the local level. And one other thing that I'll say about evaluation is that perhaps you have experienced this too, that funders often want evaluation, but they rarely want to fund it. So again, having that flexible funding that you can access to try to support these efforts is really going to help you in that effort. And next slide, please. So I will leave you with this of how our strategy all fits together at Operation Food Search. If you look at the green box and it says meeting the immediate need, you'll see that we do emergency food distribution, which is, again, the traditional food bank model. We also do summer meals. We do a weekend backpack, and we also do after-school meals. That was really the way that we were running the organization for, basically since the inception. In the year 2000, we began to work with Share Our Strengths and starting to build nutrition IQ into our work. But now we're taking that to the next level and really thinking about how can we provide that expertise to systems development. So working with organizations to see where we might be able to help them elevate their nutrition IQ and building that within their systems, like hospital systems, for example, or educational systems as well. And then lastly, what I talked about since 2017 is championing change, and this was a whole new pillar for us. And that's where our policy advocacy and innovation projects live, and where a lot of our capacity building projects are found at Operations Food Search today. But that is what I have to share with you today around capacity building. I hope that there is something that I mentioned that is a good takeaway for you. And with that, I'm going to turn it over to my colleague, Sandy.
Thank you. Thank you, Lucinda. Next slide, please. I will try to build on Lucinda's excellent work and discuss the Colorado specific case in trying to alleviate hunger. I'll discuss the key factors that support health system food insecurity work in Colorado, how the assessment of the health system food insecurity work informed the need for capacity building, and conclude with a current innovation project whose goal is to maximize enrollment of Medicaid beneficiaries in SNAP and WIC. Next slide. A key factor to supporting the health system food insecurity work is partnership. We were fortunate in Colorado to have a nonprofit, Hunger Free Colorado, who has done great work in advocacy to alleviate hunger, as well as they have a statewide food resource line. People that man that line help clients apply for SNAP. They refer them to WIC, connect them to other food nutritional assistance programs, as well as to other food resources throughout the state. Kaiser Permanente in Colorado, which is a nonprofit health organization whose mission is to provide high quality, affordable medical care, as well as improve the health of the community, partnered with Hunger Free, as they both saw alleviating health as promoting well-being and health. The funding for Hunger Free Colorado was partially through Kaiser Permanente Community Benefit, as well as other nonprofits. The beginning of our innovation together was in 2011, where Kaiser Permanente and their pediatric clinics instituted the Hunger Vital sign. With when people screened positive, we were able to give them the Hunger Free Colorado Nutrition Resource Line and instructed those screening positive to contact the line. I can't stress enough how much having this statewide organization that connected to all food resources, including the federal nutrition assistance programs, was a game changer and made this screening and referral possible. We were fortunate enough at Kaiser to have a strong evaluation team, as well as a great deal of public health expertise. And what we were able to do with Hunger Free Colorado is to measure the connection of patients screening positive to Hunger Free Colorado. When we did this initially, we found that only 5% of those receiving the card connected with Hunger Free Colorado. So together we worked on processes where Hunger Free would outreach our patients, and we increased connection to 75%. Hunger Free Colorado did something incredibly important, which was to give us information back on the patients we referred who had SNAP applications submitted and who was eventually enrolled in SNAP. And this helped inform new screening and enrollment, as well as the innovation project I will discuss, because what we found out with the other evaluation with the customer experience was that although people were really grateful that somebody asked about their social needs, they were confused about the multiple handoffs that occurred with our system at Kaiser, where a physician would refer to a community navigator who would refer to Hunger Free Colorado, and eventually the state would contact the patient. So this was very confusing, and the multiple handoffs were not resulting in high enrollment numbers. The other evaluation that was pretty critical to the work was we were lucky to have our Medicare Total Health Assessment had a food insecurity screening question, which allowed us to look back for 3 years and examine the 50,000 older adults that were screened within our Kaiser system. We found some really interesting data. The overall food insecurity was 5.7%. If you had Medicare insurance only, your food insecurity prevalence was 5.1%. If you had Medicare and Medicaid, it was 25%, so 5 times if you were a Medicaid beneficiary. Food insecurity was associated with depression, frailty, diabetes, and inability to fill prescriptions and to meet other needs. So what we used with all of this learning was to implement some of the policy change that Lucinda was talking about. Kaiser helped fund screening in other health systems, and we used a community practice model where we had Hunger Free Colorado, the state WIC leader, and other health systems working together and using data to understand what was working and not working. And we're continuing to make positive changes in that are resulting in more people being connected to food resources. The evaluation of the older adults at Kaiser was influential in helping to keep the state SNAP eligibility at 200% of free of the federal poverty level for seniors. Next slide. When we look at why there was a continued need for capacity building, or what our wake-up call was despite the great work of Hunger Free Colorado, despite the health screening, the partnerships with food banks and other nonprofits, Colorado continued to have a high rate of food insecurity. 12% of households with children were food insecure. In Colorado, there was really a low rate of enrollment of eligible residents in both SNAP and WIC. We're in the bottom 10 of enrollment of eligible populations. A new interesting finding was the low rate of Colorado Medicaid beneficiaries enrolled in both WIC and SNAP. As you know, 100% of Medicaid beneficiaries are eligible for WIC, yet only 45% of children less than 5 who were eligible were enrolled. There were similarly low enrollment numbers for SNAP. Another issue in Colorado was that only 55% of SNAP applications were resulting in enrollment. We have separate state agencies that administer Medicaid, SNAP, and WIC, adding to more difficulty in aligning and data sharing. Colorado has a county-led system, which has variable performance. And lastly, there was an anti-hunger and food policy, the food system policy was fragmented. People weren't working as well together as they could. The next slide. So in order to build capacity, the Colorado Blueprint to End Hunger was developed. The initial funding was through the Colorado Health Foundation, and it has since built on other funders. What the Blueprint has been able to do is to align efforts and develop vision, goals, and strategies, which include maximizing enrollment in the federal nutrition assistance programs. It also includes improvement in the food system, in the food relief system. We were, with the Blueprint to End Hunger, able to expand partners. At the table are county workers, state human service, and WIC directors. We have clients with lived experience, health systems, educational systems, other nonprofits, the early childhood system. So we really were able to bring more people to the table. And one of the first things that we've done this year is to hire an evaluation firm to build out the evaluation framework. And we thought that this was key in order to be able to not only understand what is working, but to continue to build on joint knowledge, to have the common metrics to understand what's working and not working and what needs to be lifted up. The Blueprint's been able to leverage other funding opportunities and really has worked together to develop a common policy agenda. Next slide. One of the Blueprint work groups is maximizing enrollment in SNAP and WIC. And we decided that the best thing to do was to really focus on Medicaid beneficiaries. And the reasons were the high prevalence of food insecurity, as we saw with the older adults at Kaiser, the under-enrollment of the Medicaid beneficiaries in SNAP and WIC, the fact that they're much more likely to be eligible for the programs, and SNAP and WIC have been associated with improved health and health care cost savings. So what we've done to date is develop a big partnership. We have clients with lived experience, state and county agencies that are administering Medicaid, SNAP, and WIC, our SNAP and WIC outreach partners and healthcare systems. We're using some grant funding to fund this work. We've developed a logic model, and we have the initial state data matches of Medicaid beneficiaries not enrolled and are working to continue obtaining that state match. And then we're working together to figure out what are the state, county, and Medicaid policies, practices, and incentives which need to be changed to increase enrollment of Medicaid beneficiaries in SNAP and WIC. So this is just an example in Colorado on how we have tried to capacity build in order to be move upstream and alleviate hunger in our state. The following slide is just a slide of resources and community practices. And with that, I will end.
Thank you so much, Sandy. These were two very interesting presentations, and I think very helpful to attendees. And thank you again to all the attendees for your patience. We do have about 10 minutes or so for questions. So if you do have a question, feel free to add it into the chat box. I see some questions being populated now, and I will just field them as they come in. And like I mentioned at the beginning of the webinar, if you have additional thoughts or questions or insights, particularly for these two experts, please use the Forum B site as the place to have the ongoing conversation following today's webinar. So the first question that I'm actually getting in is something directed to Sandy. Who leads the Colorado Blueprint Coalition? And just other related questions about that.
There is a governance structure that was formed, and they hired staff to implement. There's a overall director, a policy director, a community engagement director, and now an evaluation team. So the Health Foundation, Colorado Health Foundation, was able to start the blueprint, but the blueprint has now been able to get other funding and leverage larger grants to fund the work.
Thanks, Andy. There's another question that came in about receiving a copy of the slides. We will post a PDF of the presentation on the Forum B site. So that will be posted there along with a recording of today's webinar for anybody who's interested in particularly in the first section as well. If there's any other questions that are coming in. One question that I had probably for both of you is, are there any challenges that you can speak to specifically as it relates to capacity building that you may have experienced personally?
Lucinda, do you want to go first?
Yeah, I think that it's, with capacity building, you're often growing, and growth means change. And a lot of people, you know, some people are really great about change, others are more reluctant. And so it's just, I think that to keep a watch on how people are responding to change and helping them get through that, you know, some of the more difficult points of new implementation.
I'll build on that, and I think one of the issues in Colorado was that many nonprofits, funding is difficult, and I think there was always the concern is, will I lose some of my funding if I'm part of a larger effort? I think that our experience to date is that we're beginning to be able to tap down more national grant opportunities because people are working together and aligning efforts. And we're also able to really more holistically address problems, because I don't think one nonprofit alone can do it all. So having a much larger infrastructure has helped address some of the previous challenges.
Great, thanks. There's another question that came in for Sandy. It says, have you looked at policy change around auto enrollment of Medicaid beneficiaries in federal food assistance programs, more like an opt-out option or more targeted outreach to Medicaid beneficiaries who are not enrolled in WIC or SNAP through a data sharing agreement?
I think that's exactly what we're trying to examine right now. We've just hired a contractor who used to be lead the Medicaid work in the state to understand what is needed to do that well. And then I think that that is exactly what we're hoping to accomplish.
Thanks. And then this may be our last question, the last posted one so far. Question probably for both of you. As SNAP eligibility requirements change frequently, how are you measuring your success in getting people enrolled? What data sources do you use?
Sandra, do you want to go ahead and tackle that one?
We are, I can't, I'm sorry, off the top of my head, I can't remember the data source, the USDA data source that we're using, but I can get back to you with that. And I think that as the program requirements change, it really does make multi-benefit enrollment more challenging in the online platforms that are trying to encourage multi-benefit enrollment more challenging. But I'll get back to you with the exact data source. Thanks.
Thanks, Sandy. And we had one last question pop in, and then I will close out today's webinar. There has been a lot of conversation at the national level about the role of Medicaid and Medicare in paying for initiatives that address food insecurity. How does this fit into your efforts to build capacity?
So I think that's
go ahead, Sandy.
I think at the state, what we're looking at is, you're right, there are a lot of levers that Medicaid can use to improve food security. And some of them are like a quality metric on percent of your eligible population that's enrolled. So these are, so we're working with Medicaid to understand which levers they're interested in working on together and which target population.
And at Operation Food Search, unfortunately, Missouri is a state that didn't expand Medicaid, but I had mentioned our Fresh RX programs that are working as food as medicine. One of those is working with the pregnant women on Medicaid, and we are partnering with Washington University to collect health outcome data for looking at how food, nutrition services, and bundled support systems can lead to healthy pregnancies and healthy births. And our goal for that is to show that with a small investment of food and these supportive services, that costs downstream in the healthcare industry, particularly related to NICU and other services, could be avoided. And so we're working with Medicaid and the Medicaid managed care organizations to see how we can make food a reimbursable healthcare expense.
Great. Thank you so much, Lucinda and Sandy. I think that's all the questions we have time for today. Thank you again, everyone, for bearing with us through the technical difficulties, and thanks to our two expert speakers for a wonderful presentation and discussion. Just a few housekeeping items before you log off. Just a quick reminder to visit the Forum B site. Our experts will be on hand, ready, and engaged in the conversation there. So please post your questions and thoughts via Forum B. Stay tuned for an email follow-up from Root Cause, and in it we'll have a very short survey about today's webinar. So if you can take a few minutes to just complete the survey, that's helpful for us in guiding future webinars. And then if you haven't registered yet and are interested, the next Housing Insecurity Learning Cohort session will be this coming Thursday, same time, 1 p.m. Eastern. So that's it for today. Thank you again for your participation and have a wonderful afternoon. Thank you.